tribe students, so that no tribal child is deprived of education due to financial hardships. To promote forest-based livelihoods, 100 Vandham Dhan Vikas Kendras are being set up under the PM Van Dhan Yojana with an outlay of 15 crores. I propose to further promote tribal homestays in tourism potential areas with financial support of 5 lakhs each per unit to create sustainable income opportunities and community-based tourism models. A pilot community platform for tribal artisans and clusters is being launched with 50 lakhs to improve branding and market access. The extension block of Lal Ded Hospital in Srinagar will be commissioned in 26-27 at a cost of 180 crores to augment gynecology and obstetrics capacity with 108 additional beds and an NICU facility. We will also introduce the IVF facility in Lal Ded Hospital. The construction of a 249-bedded mother and child care hospital at GMC Anantnag will be initiated in 26-27. I further propose to establish full-fledged emergency medical departments in all government medical colleges over the next 2 financial years to ensure round-the-clock trauma care, rapid emergency response, and improved survival outcomes for accident victims and critical patients. Cardiology services are being strengthened with the inauguration of 2 new cath labs at GMC Anantnag and Jammu. With further funding, 17 critical care blocks, 2 100-bedded and 12 50-bedded are under construction. I propose to strengthen advanced cardiac care services in Jammu and Kashmir by establishing cath labs at Government Medical College Rajouri and Government Medical College Baramulla during 26-27 at a total cost of 30 crores. A cath lab at GMC Doda for the Chenab Valley will also be taken up. The Food Safety Organization will be strengthened through enhanced testing facility and funding to safeguard public health. In recent years, Jammu and Kashmir has witnessed a concerning rise in the incidence of cancer, posing a serious public health challenge for our people. Recognizing the urgency of this issue, my government will roll out a cancer control strategy for J&K in collaboration with Niti Aayog and ICMR. The focus will be on implementing various interventions and strategies for management of cancer in Jammu and Kashmir and will include collaborations for infrastructure development, training and capacity building. To strengthen peripheral healthcare systems and enhance quality and availability of medical services, my government will implement a time-bound action plan for upgradation of medical services in peripheral medical colleges based on the recommendations of a high-level committee already constituted for this purpose. The focused upgradation will lead to a significant qualitative improvement in healthcare delivery, reduce referrals on tertiary hospitals, and ensure specialized medical services reach people closer to their homes. I propose to establish 2 dedicated emergency and accident hospitals, one at Uri and another at Punch, to strengthen critical healthcare infrastructure in border areas which are prone to shelling, cross-border incidents and natural emergencies. These hospitals will be equipped to provide 24/7 trauma care, emergency surgery and critical medical services, ensuring rapid medical response during accidents, disasters and security-related incidents. I also propose the purchase of bulletproof ambulances for border districts, starting with 2 ambulances for Punch and Tangdhar in the next financial year. Last year we had started the free bus service for ladies. I propose to extend this year. I propose to extend the free government transport facility to persons with disabilities. This initiative will allow persons with disabilities better access to mobility. As a measure to ensure a strong social protection framework, I propose to provide full free waiver to all students belonging to AAY families studying in government schools from class 9 to class 12 who are not covered under any other education-related scholarship scheme. This measure will ensure that no child from the poorest household is forced to discontinue secondary education due to financial constraints. The scheme will have a high-impact investment in human capital with minimal fiscal burden. To promote equitable access to higher education for the poorest youth and prevent dropouts at the college level due to economic hardship, I propose to extend full fee waiver to undergraduate students from AAY families studying in government degree colleges who have not received any scholarship assistance under any other scheme. This will ensure that poverty does not become a barrier to academic aspiration. I propose to introduce a sponsorship scheme covering 6,000 orphan children who have lost both parents or their sole breadwinner, having no stable source of income and are not receiving any such benefit from the Mission Vatsalya framework. Each child under this will receive a monthly sponsorship of 4,000 rupees through direct benefit transfer. To support education, nutrition, healthcare, and basic living needs. This initiative reflects our government's commitment that no child shall be left behind due to circumstances beyond their control. To reduce the household energy burden on vulnerable families, improve health outcomes by discouraging use of solid fuels, and protect poor households from inflationary pressure, I propose to provide 6 free gas LPG cylinders per year. I propose to provide 6 free LPG gas cylinders per year to all AAY households of Jammu and Kashmir, covering the poorest of the poor. The scheme represents a direct cost of living relief for most deprived sections. Supplementary grant for the current financial year. The original grant for the financial year 25-26 was for 1,40,310 crore gross and 1,12,310 crore net of WMA of 28,000 crores. During the course of the year from 1st April 25 to 31st March 26, an amount of 3,077.04 crores shall be withdrawn in excess of grants in respect of demand number 1, 6 power development, 7 education, 8 finance, 10 law, 20 tourism, 32 horticulture and 36 cooperative out of the consolidated fund of Jammu and Kashmir to defray expenses on services and purposes required during this purpose. This had been largely necessitated due to expenses related to Darbar Move TA, salary arrears, purchase of vehicles, etc. My government is dedicated to expanding social security for the most vulnerable sections of society while enhancing J&K's competitiveness in the national economy through grassroots level reforms. This budget not only strengthens welfare measures but also drives transformative programs to accelerate infrastructure development, productivity and economic growth, ensuring a more prosperous and inclusive Jammu and Kashmir. We need to ensure that this is done in a fiscally prudent manner. We need to explore every avenue for upscaling revenue generation while enhancing social protection for the poor. We need to ensure cost savings through austerity measures and efficiency measures. We must also improve the impact of public expenditure by leveraging scale, competitive and private initiative. Hence, it is proposed to reduce the rebate on high-speed diesel by 2 litres. This will rationalize the price of high-speed diesel and encourage shift towards cleaner technologies. Even with this reduction of rebate, the high-speed diesel price in Jammu and Kashmir will still be lower than in our neighbouring states like Punjab, Haryana, Himachal Pradesh and Delhi. For 26-27, the total gross receipts are estimated at 1,27,767 crores, including the provision for ways and means advances and overdraft of 14,000 crores. Given these receipts, the total gross expenditure is estimated at 1,27,767 crores. The total net budget estimates for fiscal 26-27 are 1,13,776 crores, excluding the provision for ways and means advances and overdraft. This includes 80,640 crores and 33,127 crores under revenue and capital expenditure respectively under the budget estimates for 26-27, and 90,018 crores and 23,749 crores as expected revenue receipts and capital receipts respectively under budget estimates for 26-27. The own tax revenues, both tax and non-tax are estimated at 31,800 crores. In addition to this, 42,752 crores is to flow as central assistance and 13,400 crores as CSS to Jammu and Kashmir. The tax GDP ratio was projected at 7.5% for 25-26. The tax GDP ratio is projected at 6.6% for 26-27. Fiscal deficit for the year 25-26 was estimated to be 2.98%. This was substantially lower than 5.5% in 24-25. The fiscal deficit for the year 26-27 is estimated to be 3.69%, which is substantially higher than 3.63% in 25-26. GDP for the year 25-26 has been projected at 2,88,422 crores, which showed a growth of 9.5% over the previous year. GDP for the year 26-27 has been projected at 3,15,822 crores, indicative nominal GDP, which shows a growth of 9.5% over the previous year. Honorable Speaker, sir, with these words, I commend the budget for the financial year 26-27 of Jammu and Kashmir